Hello everyone. Welcome to this advanced lecture on the potential of nutraceuticals derived from medicinal plants as therapeutic targets in breast cancer. Breast cancer continues to be a major cause of morbidity and mortality worldwide, with conventional treatments like surgery, chemotherapy, and radiation carrying significant side effects and limitations, including multidrug resistance and recurrence. In this session, we will explore the epidemiology, etiology, molecular pathophysiology, current treatment options, and the role of plant-derived nutraceuticals, including polyphenols and flavonoids, in modulating key oncogenic signaling pathways such as Wnt, beta-catenin, NF-kappa B, Notch, and hedgehog. Breast cancer is one of the most prevalent cancers globally, representing a leading cause of cancer-related death among women. In 2021, approximately 2.1 million new cases were projected worldwide, with the United States alone expecting about 250,000 new diagnoses. The incidence is rising, not only in women but also in men, although male breast cancer remains less common. Risk factors for breast cancer include genetic predisposition, hormonal imbalances, environmental exposures, and lifestyle factors. For example, increased breast density and prolonged estrogen exposure can lead to enhanced proliferation of mammary epithelial cells, while disruptions in circadian rhythm, alcohol consumption, and tobacco use further exacerbate oxidative stress. Oxidative stress increases reactive oxygen species, causing DNA damage, genomic instability, and promoting tumor aggressiveness. Understanding the epidemiological trends helps us contextualize the clinical and mechanistic rationale for exploring novel therapeutic approaches, such as nutraceuticals, that can target these underlying processes. Etiology of breast cancer is multifactorial. Viral factors such as the B-type RNA virus, known as the mouse mammary tumor agent, have been studied for their potential role, but human evidence remains limited. Hormonal influences are central to breast cancer development. Estrogens promote proliferation through binding to estrogen receptors, activating transcription of genes involved in cell cycle progression. Progesterone has a dual role. In some contexts, it can enhance carcinogenesis, while in others, particularly during pregnancy, it may exert protective effects by modulating estrogen activity. Prolactin contributes to mammary gland development and has been implicated in carcinogenesis in animal models. Adrenal steroids, including cortisol and aldosterone, influence cellular stress responses and can modify tumor susceptibility. Genetics also play a role. Familial clustering of breast cancer suggests heritable susceptibility, although clear markers are limited. Collectively, these factors interact with environmental exposures and lifestyle to create a pro-tumorigenic environment. Breast cancer typically begins with ductal hyperplasia, progressing to benign tumors, and eventually becoming malignant and metastatic under the influence of various carcinogens. The tumor microenvironment, including macrophages and stromal cells, plays a pivotal role in supporting tumor progression. Macrophages secrete pro-inflammatory cytokines and angiogenic factors, which promote vascularization and facilitate tumor cells' evasion of immune surveillance. This mutagenic microenvironment creates selective pressure for tumor cells to acquire survival advantages, including resistance to apoptosis. Additionally, inflammation-induced oxidative stress contributes to DNA mutations, further driving malignant transformation. Understanding these mechanisms is essential to appreciate how nutraceuticals may intervene to modulate signaling pathways and suppress tumor growth. There are two principal theories explaining tumor initiation. First, the stochastic theory proposes that any breast cell can acquire mutations over time. Random accumulation of genetic or epigenetic changes eventually transforms normal cells into cancerous ones. Second, the cancer stem cell theory posits that a specific subset of progenitor cells, known as breast cancer stem cells, give rise to all tumor subtypes. These stem cells possess self-renewal and differentiation capacity, allowing them to produce heterogeneous tumor populations. Epigenetic alterations in breast cancer stem cells, such as DNA methylation and histone modification, interact with signaling pathways to maintain stemness. Both theories have implications for therapy. While stochastic models suggest that targeting proliferating tumor cells may be sufficient, the cancer stem cell model indicates that eradicating stem cell populations is necessary to prevent recurrence. Breast cancer stem cells hijack several developmental signaling pathways that regulate self-renewal, differentiation, and proliferation. The hedgehog pathway regulates transcription factors like GLI1 or 2, promoting proliferation and stemness. The Notch pathway influences cell fate decisions through ligand-receptor interactions, controlling differentiation and apoptosis. NF-kappa B signaling mediates inflammatory responses, apoptosis evasion, and therapy resistance, often via upregulation of anti-apoptotic proteins like B-cell lymphoma 2 and survivin. The Wnt beta-catenin pathway is highly conserved and maintains stemness by regulating transcription of genes involved in proliferation. Dysregulation of these pathways contributes to therapy resistance, metastasis, and poor prognosis. Targeting these pathways pharmacologically or via nutraceuticals offers a promising therapeutic avenue. Wnt beta-catenin signaling is crucial in both normal development and breast cancer pathogenesis. In normal cells, beta-catenin is degraded by the destruction complex, maintaining controlled proliferation. In breast cancer, aberrant Wnt activation stabilizes beta-catenin, which translocates to the nucleus to activate transcription of stemness and proliferation genes such as cyclin D1 and cellular myelocytomatosis oncogene. Inhibition of Wnt1 or modulation of miR142 reduces mammosphere formation and tumor-initiating potential. Protein kinase D1 activation suppresses glycogen synthase kinase 3, beta-catenin signaling, diminishing stem cell characteristics. Nutraceuticals like resveratrol can down-regulate WNT signaling, suppressing breast cancer stem cells self-renewal and tumor progression. The nitrogen monofluoride kappa B pathway is constitutively active in multiple breast cancer subtypes, particularly human epidermal growth factor receptor 2 positive and triple negative tumors. Activation promotes transcription of genes controlling proliferation, survival, and angiogenesis. NF-kappa B also enhances expression of anti-apoptotic proteins like survivin, conferring resistance to chemotherapy and radiotherapy. In breast cancer stem cells, NF-kappa B is critical for forming secondary mammospheres and maintaining stemness. Therapeutic modulation, such as by melatonin, can down-regulate nitrogen monofluoride kappa B expression, reducing tumor proliferation and sensitizing cells to conventional therapy. Local treatment includes lumpectomy and radiotherapy, replacing radical mastectomy for early breast cancer. While effective for localized tumors, residual micrometastases often persist, necessitating systemic therapy. Hormonal therapy, such as tamoxifen and aromatase inhibitors, targets estrogen receptor signaling. Chemotherapy combinations act on proliferating tumor cells, but efficacy is limited in older patients or those with therapy-resistant breast cancer stem cells. Understanding the molecular basis of residual disease explains why combination strategies, including nutraceuticals, may enhance therapeutic outcomes. Nutraceuticals are plant-derived compounds with bioactive properties that target key oncogenic pathways. They can induce apoptosis, inhibit proliferation, and suppress angiogenesis. Polyphenols, flavonoids, terpenoids, and alkaloids have been shown to modulate signaling pathways such as Wnt, beta-catenin, NF-kappa B, hedgehog, and Notch. Their pleiotropic nature allows simultaneous targeting of multiple hallmarks of cancer, offering a safer alternative or adjunct to conventional therapy. Importantly, nutraceuticals may sensitize tumor cells to chemotherapy while reducing systemic toxicity. Polyphenols have demonstrated significant anti-cancer activity in preclinical breast cancer models. Curcumin suppresses epidermal growth factor receptor expression and induces apoptosis in MDA metastatic breast 231 cells, modulating downstream phosphoinositide 3 kinase or AKT and mitogen-activated protein kinase signaling. Resveratrol inhibits Wnt, beta-catenin signaling, reducing proliferation in MCF10A, MCF7, and SUM159 cells. Eugenol suppresses nitrogen monofluoride kappa B signaling, lowering interleukin-6 and interleukin-8 levels, thereby reducing inflammation-driven tumor progression. Each compound's mechanism is dose-dependent and involves complex interactions with multiple molecular targets, highlighting their potential for integrative therapy. Oloripine from Olea europaea inhibits xenograft tumor growth, potentially via modulation of apoptotic and proliferation pathways. Pterostilbene, a stilbene derivative from Cyanococcus, inhibits mTOR and AKT phosphorylation and suppresses cyclin D1 expression, thereby arresting the cell cycle and reducing breast cancer stem cells self-renewal. These compounds demonstrate that dietary phytochemicals can interfere with critical oncogenic pathways, complementing conventional therapies and potentially overcoming resistance mechanisms. Flavonoids, widely present in fruits and vegetables, exert multiple anti-cancer effects. Nobiltine from citrus depressa inhibits extracellular signal-regulated kinase 1 or 2, induces G0, G1 arrest, downregulates cyclin D1, upregulates P21, and suppresses mTOR, AKT signaling, promoting apoptosis via downregulation. Baekeline from Scutellaria baelensis reduces nitrogen monofluoride kappa BP65 expression, decreasing BCL2, BIRC2 or 3, and CCND1, resulting in cell cycle disruption and reduced proliferation. Ellagic acid, found in pomegranates and berries, regulates the transforming growth factor beta, SMADS pathway, inducing apoptosis. These flavonoids provide a mechanistic framework for nutraceutical intervention in breast cancer therapy. While preclinical data on nutraceuticals is promising, clinical translation requires careful evaluation. Issues such as bioavailability, metabolism, and herb-drug interactions are critical. Nutraceuticals may act synergistically with chemotherapy, reducing toxicity and enhancing efficacy. However, their precise effects in humans, optimal dosing, and long-term safety remain areas of active investigation. Ongoing trials are essential to validate preclinical findings and determine clinical applicability. In conclusion, breast cancer is a complex, multifactorial disease driven by genetic, hormonal, and environmental factors. Key signaling pathways, including Wnt, beta-catenin and nitrogen monofluoride kappa B, govern proliferation, stemness, and therapy resistance. Plant-derived nutraceuticals offer a mechanistically rational approach to target these pathways, modulate apoptosis, and inhibit tumor progression. While ancient medicine has utilized these compounds for centuries, rigorous research and clinical trials are needed to optimize their use. Nutraceuticals represent a promising adjuvant therapy to complement conventional treatment, with the potential to improve outcomes and reduce adverse effects for patients. This concludes our overview on nutraceuticals in breast cancer mechanistic perspectives.